Okay, well, you talked about the causes being tonsil and adenoids, especially in kids. The size of the airway. How come everybody isn't born with an airway that's the right size?
We're all made different.
I mean, seriously, you just think, no, mine's made just fine.
The amount of difference from individual to individual when I look in their throat is absolutely astounding. Generally speaking, the smaller the airway is, the more likely you are to have apnea. That's just a generalization. Sometimes you look in someone's mouth and what you see doesn't indicate they're going to have severe apnea. Sometimes there's a problem with their facial structure, their bony structure. So it's not just what you see when you look in the back of the throat.
Exactly. Well, I was going to talk about the congenital structural problem, and I wanted to talk about deviated septum. Can you tell me what is a deviated septum? Because it has a lot to do with snoring.
Deviated septum, your septum is the middle partition of your nose, and it's not in the middle. It's one side or it's the other. It may have a spur in it. And it changes things. Probably the first thing I think of when I see a deviated septum, if someone can't breathe through their nose when they sleep, they open their mouth. When you open your mouth, the airway gets smaller. Intuitively, that doesn't make sense.
Wow.
But it's harder for you to inhale when you're sleeping with your mouth open than with your mouth closed. So some people, consequently, will have apnea and snore when they have a cold because they can't breathe through their nose. So if nothing else, just that.
Well, we think we're saving ourselves by breathing through our mouth because surely you can get plenty of air that way if you can't breathe through your nose, and you just said the opposite's true. That's fascinating.
Yeah, your resistance, how hard it is to suck in a breath when you're sleeping with your mouth's open, it's more difficult than if your mouth's closed.
That is a great thing to know. I just learned that. Well, when is snoring a significant sign of sleep apnea? Because you said snoring is on the inhale. What sometimes happens on the exhale?
The first thing, do you or do you not snore? If you don't snore, you probably don't have apnea, with a few exceptions. The snoring, if you notice a stopping in the snoring, that usually indicates you quit breathing. Often, you'll hear a snort. There's a snoring also, it's a loud snort. That's also an indication that someone has quit breathing. What often happens, this is a process as you get older, you start snoring, the snoring gets louder, you start getting apnea, and then after a while, you don't snore much anymore because you're not breathing hardly at all. So often I'll see someone come in and I'll ask, do you snore? And the wife says, no, he doesn't snore, but boy, he used to. And the problem is now there's not enough air movement to even make any more noise. So that's usually a very ominous sign. If you had snoring in the absence of anything else happening, it now isn't very noticeable.
Wives and husbands, if your spouse snores, that's a good tip. If they have been doing it and they stop, things are getting worse,
that's
not
right.
better. Oh, my goodness. Well, what are some of the possible consequences of untreated apnea?
First, what's obvious is that you're sleepy. And not only are you sleepy, you don't have as much energy. Not only are you sleepy and not have as much energy, you can also actually feel short of breath. If your sleep is disrupted for any reason, you're not going to be as energetic the following day. If you're a competitive athlete and you had a bad night the night before, you're not going to run as fast or as far as you did. So the sleepiness, energy level, actually a feeling of being short of breath, executive functions can be affected. When I say executive functions,
about cognitive?
Right.
Okay.
The ability to problem solve, to make decisions, to react, those things can be affected. Then there's the things that happen, the other part of your other brain thing is stroke. The incidence of having a stroke is much higher in people who have apnea than people who don't, or snorers for that fact. After stroke, heart attack. The incidence of having heart attack and heart failure, which is a weak heart muscle, is also there, and high blood pressure.
I wanted to mention that the stroke conference for 2009 had a whole segment about sleep apnea and stroke. So they are pushing that to the forefront and causing doctors to take notice of it because of the threat to health.
Right.
Also, I just read from the American Heart Association that 60% of pacemaker patients had sleep apnea. And so I thought that could possibly be the reason why their heart got so bad that they had to go on and try to treat that with a
Well, what
pacemaker.
happens too when you have really bad apnea, one of the things your heart does in the process of fighting and recovering from the apnea is your heart rate can get very, very, very dangerously slow.
Right.
And some people get a pacemaker because their heart was beating so slow. And it might be they got a pacemaker because they had apnea. Well, now what doesn't make sense to me is that if you have apnea and you got a pacemaker, your apnea gets better, which, why would that happen? I don't know.
Oh my gosh, I would much rather catch that on the front end than on the back end.
Right. I'm not saying everybody who snores has a pacemaker didn't need it, but, but there's a large number of people. And often I'll get patients referred to the sleep lab by a cardiologist because someone has a low heart rate only in sleep, and he wants to know, is it apnea? And if it is from apnea, if the apnea is treated, that low heart rate while sleeping goes away.
Right. The other thing I wanted to bring up about what is happening because of the cessation of breathing is that during the night, your blood oxygenates your brain. Because you're breathing, you're taking in a certain amount of oxygen, it processes it, and it goes around and does its helpful things. And so when you're not able to do that, that's one of the reasons why you're not thinking clearly the next day. You don't feel well. You're not even getting the oxygen you need for a...
It's a double whammy. You don't get enough oxygen when you're
Heart
sleeping.
rate slows down.
And you get all these crazy arousals. And because you're going to have problems with your thinking even in the absence of a low oxygen level. But when you get both, it's got to be worse.
Right, and then how does apnea affect diabetes?
Apnea makes blood sugar control worse. And the thought is when you're sleeping and you're struggling to breathe, you release adrenaline, which is a hormone that you normally use for fight or flight. That's what makes you get all excited when you're in trouble. But it also mobilizes blood sugar. So blood sugar control is going to be more difficult in a person with untreated apnea than someone who's treated with apnea. I'm not going to say if you have diabetes and you have apnea, we treat your apnea, your diabetes is going to go away. No, but most of the time your diabetes will get better. It'll be easier to treat.
And who wants adrenaline going through your system when you're trying to sleep at night? It's already hard enough with the apnea.
Right.
So yeah, that's really a dangerous scenario.